Happy 2022, everyone. We're back with Doc Talk. Ending last year, we were really hoping to be able to bring good news about the ongoing drift down of COVID cases. That is clearly not what I'm here to report on today. So welcome to 2022. The news is extraordinarily mixed. Some of you are in zones where the Delta variant and subsequent serious illnesses and deaths are still making life miserable for your population, for your members, and for the community overall. And we've had significant issues still with hospital capacity in some areas of the country. That backs up into hospital diversions and rerouting and wall times and all the things that make operations very difficult for us. We have a second phase of operations in the country, which is areas that are heavy in the Omicron variant, where lots and lots and lots of people are sick. They're sick with the Omicron variant, which has different clinical characteristics we're going to talk about with it. And in those places, the workforce is challenged because large numbers of personnel are testing positive. They feel miserable for a couple of days. They fortunately seem to recover very quickly, and they want to get back to work because all the rest of the workforce is getting sick. So over the holidays, that hasn't been fun. Many of you have been working very hard, overtime, covering people, getting called into work, forced in, or we're at brownout stages in many of the bigger departments where we can't put equipment in service because we just don't have staffing. And we're at emergency crisis standards for getting apparatus on the streets. That may end up, though, being good. So let's talk about Omicron again. Omicron seems to be a different illness than the original variants of COVID. So let's imagine you would look at this like you'd look at different kinds of flus. Some of which make people really sick and some of which don't. We seem to be at a point where the Omicron variant causes a more mild illness, particularly in people who were vaccinated or who had the illness before. If you have the illness before, it's called reinfection. If you had the vaccine before, it's called breakthrough infection. So just so you're aware of those terms, and you'll hear some differentiation of those terms and all that is going on in the media. Delta seems to be able to go through your defenses that were based either on a prior infection or the vaccine and give you a minor infection that centers around the upper airway and not the lower airway, which is really important. It also seems to come on much quicker. And the science right now says you are exposed about 2.5 or 3 days later, you develop the illness. You're sick for 2 to 3 days and you feel much better and you quit spreading the bug. That's really good news because people are not going into the hospital for that unless they have other problems. They're not dying of that variant. It also shrinks all of the time down where you have to think about being off work, being away from your family, not going out in public, et cetera. And it shrinks the amount of time it takes to get through the population. And for some of you who believe, this is going to come and it's going to affect a certain amount of people and go, we have really shrunk the time down that's going to impact our society. In the countries where Omicron has hit, they've had very, very rapid upswings in the number of cases and very rapid downturns in the number of cases. And if that occurs in this country without causing rapid increase in hospitalizations or deaths, then we have survived the best that we can. So here we are. We have some testing issues. We have some treatment issues. We have some back to work issues. And then we have the usual issues around PPE, masking, and when we can get back to normal, And that's really important to all of you. So let's go through this. Diagnostic testing. We had not been producing the same number of test kits thinking that we were on the downswing away from COVID. So you will notice there's a manufacturing gap and there's a significant gap now in being able to get tested. and be able to go anywhere that you want to go and pick up a home kit. We had not planned, we meaning collectively society and leaders, I didn't have any part in this, but we have not been manufacturing the test kits. It appears most kits, there are 3 exceptions. Their names are available on the internet if you want them. There are 3 kits that are not finding the Omicron. They're set up to look for other variants. And there are 3 that are not widely used or distributed or part of any public health process. So for the most part, with just those few exceptions, testing, looking for Omicron or looking for Delta, it doesn't matter, it's going to show it up. In many states, they are not going to give you an answer about what type of variant you have. So you are sick with COVID, and that illness, they won't tell you is Delta illness or Omicron illness or any other type of COVID illness. While I'm speaking of this, just so everybody knows, there's lots of other respiratory infections that are winding through. And in many places, we have influenza A, we have RSV in the kids. We have a bunch of other of the named viruses. So just so you're aware, there's a lot of other stuff moving through, but let's go back to COVID. So you're sick. Now, Delta has given us the traditional kind of symptoms. It begins again a little later, exposure, and about 5 days later, you start to get sick. That sickness is fever. It is some congestion, a sore throat, a cough, and then you get some aches related to having the fever. Very typically, and especially it seems among fire EMS and PD personnel, law enforcement personnel, you lose your smell and you lose your taste. And that's been a clear differentiator of COVID so far. All right, fast forward to Omicron. Omicron seems to be producing milder symptoms revolving around a congested nose, sinus fullness with the headache that goes along with that, a tickle or a little bit of a minor sore throat, a fever with the body aches and headache that go along with that. No loss of taste and smell. And it's very rare that it is dropping into the lungs. So that is a difference in the symptoms that may be little clues to which of the variants that you have, and really helps us understand what may be different about this new variant. It does not seem to penetrate into the brain area, and it doesn't penetrate into the lungs. Those are the 2 things that were killing people, and it will really be good if we find out the Omicron variant does not do those things. Number 3, vaccines protect us from either of those, but Omicron has been so superficial that our antibodies have a harder time getting to it. So if you will, it gets into your system. It lives on the beach, which is the surface of your mucous membranes. It gives you a little bit of symptoms, but it hasn't been dropping our fire EMS law enforcement personnel into serious illness. So frustrating that you're getting reinfected, frustrating that we're getting breakthroughs even if you're vaccinated. I've had some of my co-firefighters, some of my other medical director friends, some other emergency physicians frustrated that they got sick, but 2 days later, they're feeling fine. All right, so that's symptoms, that's timing. And now what do we do about treatment? Well, over the holidays, we've had the approval of 2 new oral treatments. One is a pill made by Merck, one is a pill made by Pfizer. Very long names, molnupiravir and Paxlovid. So we have 2 pills. The Merck pill, a little less effective. The mechanism of it is it goes into your cells and it changes the way that the virus can replicate itself in the cells and make new viruses, which is how they have to get their little viral life to go on to more people and to infect you even worse. So the Merck pill messes with that mechanism. There's some concern, even with a 5-day course, that may produce some changes within cells that are uncomfortable for people. And so you will hear that if you are offered a Merck pill or a Merck course of pills, which is a 5-day course to take for your illness. That is relatively available. the Merck treatment is relatively available in that they've been manufacturing millions of doses, and they've been trying to get them out into the community, although distribution is still not perfect. So if you're sick and you think the Merck pill is for you, you may still have difficulty finding it in your community because the distribution of it hasn't been perfect. In general, they're going to recommend against the Merck pill for pregnant females or females who may become pregnant. So be aware of that. And there's a rather lengthy list of medications that you can't be on and be on the Merck pill. The Pfizer pill, I'm going to talk about it. It's based on the same mechanism of pills that we have been using to fight HIV. And you know how successful we have been in reducing the death toll of HIV, even though we still have millions of individuals who have that infection. The course of medication that they have been using has been fighting that infection successfully and keeping those people from getting ill. That same technology is built now into Paxlovid, which is the Pfizer pill. Let me shortchange this by saying right now there's very little of the Pfizer pill that is available. And for the next few months, there's going to be very little of it. The course of treatment, even if you're given a prescription for it, will likely not be available. And what little bit of medicine is available will likely be used for people who have underlying medical problems who can't benefit from the vaccine but got the infection. Okay, so those are the two pills. We have now 4 monoclonal antibodies to talk about, 4 of them. But right now we are thinking 2 of them do not work on the Omicron variant. And so if you get Omicron, there are 2 of the monoclonals that will not be effective and will not be recommended for it. There's one remaining one, sotrovimab, long name. It's given a single IV infusion. It also is in short supply. And for right now, will be relatively unavailable for the next month or 2 to treat people with Omicron infections. The 2 old pills, I'll call them Bamlam and Regeneron, are still being used in areas where Delta variants are still causing a lot of the illness. So some of you who work in those areas may hear about monoclonal treatment and will hear about Bamlam or Regeneron in an infusion center to be able to give to those individuals who are recently ill with the Delta variant. And you go for your single infusion, and hopefully it keeps you from getting a more serious illness and drop it into the hospital. All right, there's a 4th one, and the 4th one is Evusheld, which is a prophylactic monoclonal antibody. It is given in an IM injection one time to prevent people from getting illness. It is right now being manufactured for people who can't get the vaccine or won't get an effect from the vaccine because their immune system is compromised. And we only have enough of it to use in that population right now. In the future, it's possible that we can use the Evusheld or a version of it into the future that will prevent infections in those who, for some reason, are at risk for getting it and can't get the vaccine. All right, that leaves us to our vaccines. Pfizer approved today in its original dose and a 3rd dose all the way down to age 11. We have Pfizer available in the original doses and the peds portion down to age 5. But above that now recommended for Pfizer and Moderna is 3 jabs, 3 immunizations for all of them. For Moderna, still 18 and above for the age groups. If you got the J&J, it's recommended that you get a second vaccine of the mRNAs. So that's either the Pfizer or the Moderna. So that's a vaccine. It's still a great idea. Getting people boosted gives you maximum protection against any of the infections, but in particular against getting serious infection, hospitalization, or death. All right, return to work. It is in evolution. And with that shorter course I just described of Omicron, we are at a period of time where likely the recommendations this week will come out from the CDC that say 5 to 7 days of quarantine or isolation. And by the different groups, immunized, not immunized, underlying immune compromise or not, essential workers or not. I'm just going to make it short and say it is very likely for us as essential workers, healthcare, law enforcement, fire, EMS, that we will only benefit from a short course of isolation if we get ill and have a positive test, or quarantine if for some reason we get a high-risk exposure, we haven't been fully vaccinated, and we need to protect others around us to keep us from not infecting them. Also, as part of that return to work, for people who got exposed but are not ill, they may wait for 5 days at home away from other people. On the 5th day, get tested in their nose. If it is negative, you're returned to work. Many of you are back in the masks. It's with me everywhere I go. All the communal areas within our stations, everybody's wearing a mask, whether they're vaccinated or not. I didn't think we'd be there again, and we are. And then out in the community, we're masked up. In all patient care, we're in N95s and higher. Long talk today. I apologize for going a little bit over. There's a lot going on. The next couple of weeks are really critical. You're going to watch the numbers of Omicron infections continue to go up. It's going to be very depressing. Most of you are going to be working overtime. And they're just the holiday spread and the effectiveness of the spread of the Omicron variant is just tremendous. And so please don't get despondent. What may be good is that we'll have this rapid upslope. We will not have death. We will not have hospitalizations. We won't collapse our healthcare system. It will go down. And if we are doing things well and we're preventing other variants from forming, by the time warm weather gets here in this country, we may be over this in its pandemic phase and ready to move into a phase where we're back to a new normal. We are back to being able to communicate with each other, go to conferences, go to church, go to concerts, go to sporting events without wearing all the latest, and be able to then concentrate on the other things that are missing in our community, rebuilding our emergency care system, rebuilding our health system, all the good things that we've wanted to do every day when we go into work. So first of the year, 2022 may be a great year for all of us. By summertime, fall, back to interacting the way we normally do, we'll be blessed if that happens. But we've got a little work to do before we get there. So you be safe, mask, vaccine, stay healthy as you interact with other people. Be aware that the other silly stuff is going around that we catch every winter and pass to each other, particularly the kids are passing around all of the usual pediatric stuff. So be prepared if the kids come home from school or daycare and they got a snotty nose. So I want all of you to be safe. I want a great 2022 ahead of us. We're going to make it work, okay? Thanks, everyone. Until next week, Doc Talk. Thank you.